So hello, let's talk about it. We have a lot to talk about. We're going to talk about what I know next. Oh Lord, chronic care management. I love right now. I'm doing it pretty well. Chronic care management, work from home medical business. Also, some of you have expressed interest in remote patient monitoring, RPM. We're a great add-on to your any kind of business, especially your chronic care management business. So let's talk about it. So if you do not know me, I am Dr. Sheila Fales, a family nurse practitioner. I have been one for over 20 years. My specialty is primary care, adult geriatrics, and diabetes. I teach nurse practitioner students with Walden University. Oh, and I cannot forget, I am a Sunday school superintendent and teacher, published author. I have had an established clinic since 2014. So when COVID came, I did not miss a beat. I do house calls. I do telehealth. I am the psychiatric provider for the city jail. I'm a clinical consultant, which that's what you would do. Reach out to different clinics and offer your services of how you can make them extra money. And I teach medical credentialing, coding, and claims. Disclaimer, I will share with you what has worked for me. Love this. Not official legal advice, and I currently do not have any corporate affiliation. I'm not trying to sell you anything but my services. Always check with your state laws and or your governing body, whether it is the Board of Nursing or the medical board. So we did complete our first boot camp. Oh, there you go. There it goes. It was a success. By the time our participants left within those 2 days, they learned from the rooter to the tutor how to establish their business. They learned billing and coding. They still have contact with me if they have any questions or concerns. So it was considered a success. And guess what? We're doing it again this week. You have 2 more days to sign up for it. Looking at Friday night. Actually, it's a 10-hour. I kind of calculated 10-hour power training. We're going to do Friday night from 7 to 9 p.m. Friday night, we're doing business establishment. We're going over chronic care management. I think even Friday night, we're going to learn about getting that medical director. All day Saturday, I'm ready to work 9 a.m. to 5 p.m., which we made last time we got out a little early. But, no, we've added a few more modules. We've added telehealth, and we've added remote patient monitoring. This course will be recorded. If you're not able to attend live, you can receive the recording. So like I said, we're talking about everything. We show you how to get a medical director. We show you how to get credentialed with the insurance company. We help you or start you with your marketing. We're giving you the sample contracts. We're giving you flyers. We're giving you referral forms, assisting you with your logo, showing you how to negotiate and contract. We're teaching you billing and coding. Where do you submit your billing and coding? Guess what? We're going to do some annual wellness visits. I got some patients lined up, and they are ready to answer your questions, and we are providing you care plans before you leave that weekend, brand new modules, how to start a telehealth business, and of course, remote patient monitoring. So let's talk about it. What is chronic care management? It's been around for a while. It is care coordination with the patient with at least one chronic condition that is expected to last at least 12 months. So practitioners can bill when you have at least 20 minutes of non-face-to-face clinical staff time. That's things like referrals, looking up medications, making appointments if that's what you choose to do with your patient. This is strictly virtual. It does not even have to be video. It's telephone, email, snail mail, that's regular mail, or even text messages, at least every 30 days. We already have studies out showing the effectiveness of text messages. This is completely work from home. The care plan is managed by a nurse practitioner or a physician. And guess what? Check out cms.gov. That is my resource. I check it frequently. They have a whole department for chronic care management. So who can do it? Yes, you can do it. I say anybody that has contact with patients, nurses, nurse practitioners, medical assistants, those unit clerks, counselors, RNs, LPNs, pharmacists, physicians. Oh, I got counselors on there twice. I wonder what that means. Dietitians, social workers. Even if you are non-medical, you can do chronic care management. Guess what? The government is willing to pay us for the things we are already doing. So who can do it? I already told you. A physician, qualified non-physician practitioner, that may be a nurse practitioner, physician assistant, clinical nurse specialist, or a nurse midwife, or anybody that you train and certify. There it goes. My mother can do chronic care management. My sister can do chronic care management. They hear it all the time. I used to do 20 phone calls on Saturdays and Sundays. They hear it. They know the speech. They know the whole flow of it. Anybody that's trained by you, certified by you, can do chronic care. Marianne and Rose, you all can do chronic care management. So what are those chronic conditions? You see it all the time: hypertension, diabetes, stroke, arthritis. These people are not always old. They just have to have Medicare. So we're talking about autism. These patients are not always old. So what is the care plan? It's pretty much what you need to be doing. Identifying problems. This is important. Expected outcomes and prognosis: fair, good, poor. What kind of family support system do they have? Measurable goals. They teach us that in school, right? Writing those goals that are specific. Have a timetable. Doing a cognitive and functional assessment. How often do they leave out the house? You know, that's a sign of depression. They're not getting out the bed. What are you eating? Planned interventions, symptom management, medical management is important. Things get lost in the system. Referrals get lost in the system. What kind of caregivers, resources, or support do they have? So there is software available to guide you. Software is not required to help, but it's not required, but an electronic medical record is. So what do you do when you're doing chronic care management? I wish a lot of you could follow me at least one day and see what I do when I do chronic care management. Pretty much you need a verbal and or written consent. You're going to have at least a monthly contact with your patient. I had found out 2 patients passed today. Not today, but with my phone calls. Updating their care plan and providing the patient a copy and the provider a copy. I needed to be there, but that's fine. CCM, you do need that initiating visit. It's going to be either an annual wellness visit, which is good. RN or LPN can do this, and it's still virtual for now until further notice. I use that evaluation and management. That's a regular visit by a nurse practitioner physician where you're asking that question: hello, how can I help you today? What type of problems are you having? So the providers like it. You know, we have those difficult patients, call frequently, so it's less phone calls for them. Patients are going to like it. They have somebody, a resource for them, and you will like it because you can get paid. It's improved outcomes for the patient. They figured it out. They're keeping these patients at home. They're not paying an ambulance for the patient to come to an office visit. They're keeping these patients at home and out of the hospital and out of extended care facilities. So let me tell you a secret, and I'm not calling you. If it wasn't effective, the government would not do it. As a matter of fact, I hear the reimbursement goes up each and every year. So how much can you get paid? I say an average of $60 per patient per month. I've seen 30, I've seen 60, I've seen 80, I've seen 100, I've seen 120, I've seen 160. Chronic care management. So I'm not hiding the codes. These are what they are. This is just a resource that I found. As a matter of fact, it's one of the probably RPM company. But it shows you the code. It shows what you can get paid. Now, I've had nurses say, well, I can't get paid what you get paid. You're a nurse practitioner. Well, actually, you see on this chart, you can. So you see physician, that means physician/nurse practitioner. It is not a price difference. For initiating, let's say, about $50. You would do additional, for each additional 20 minutes, you can get additional almost $50 per patient per month. And if they're a complex, you're starting out with that initial 60. So you'll find out, is it better to bill 20 plus 20 plus 20, or is it better to bill 60 minutes at a time? Do you need a medical director? They're waiting on you. I've reached out to medical directors. They're ready. They know what it is, and they know what it pays, so they are waiting on you. So there's a way to do it without a medical director. This is good, too. You reach out to a provider, you reach out to an office, offer your services to their patients and to their clinic. This can be a new business for you. It can be an add-on to your business. If you are doing weight loss, your patients should be on chronic care management. If you are phlebotomy, if you have a home health service, all of your patients should be on chronic care management. You can do this at your existing job. Find out if they're doing it. Market it as an outside business or your own business. A tip from me, learn how to look up fee schedules. You know what pays what. And learn how to do your own medical billing and coding. So why now? It's still the beginning of the year. It's first come, first serve. Guess what? We still have some of that public emergency guidelines still in effect. Let's get it while the get is good. Like I said, annual wellness visits are good for now until December 24th. Let's get all the patients that we can get in with those virtual visits. Like I said, it's first come, first served, first paid. You do not have to be their primary care provider, and you do not need permission from their primary care provider. Sign them up on your own. This is chronic care management. So, and there's so much more you can do. As I said, when you learn those fee schedules, you'll know what pays what. Do you know you can get paid for doing a depression screening? You can get paid for alcohol screening, smoking cessation, advanced care planning, that cognitive assessment where we're asking them to draw a clock and repeat these 3 words. That almost pays $300 by itself. I almost fell out the chair first time it paid. It's something I was already doing. And you all love those risk assessments. It's a way that you can bill for that separately, in addition to chronic care management and RPM. So like I said, it's even more to come. You got chronic pain management. There's no treatment, there's no prescribing. You're just the middleman, being a resource to the patient. Remote therapeutic monitoring, that's something different from RPM. Transitional care management, between getting in and out of hospitals and facilities. Behavioral health intervention, I'm flipping, that's your psychiatric patients. And this is my specialty, the diabetes prevention program. The program already set up with the government. You're just following their program. You're not creating your own. And let's talk about it. Remote patient monitoring. So this is a great resource to add to your chronic care management service. So I'm going to tell you my story about it. So, of course, I do chronic care management. And on all of my videos and calls, clients want to ask me about RPM. And I say, well, I'm not familiar with that. I'm not doing that. I'm not going into the home. I'm not interested. And golly gee, I heard some webinar. I listen to free webinars. Get all the information you can get. And I think I heard someone say you can do remote patient monitoring without going into the home. So let's talk about it. I'm already on it. So what is remote patient monitoring? That's when you're collecting and analyzing, good point, a patient's physiological data that are used to develop and manage a treatment plan. Real-time monitoring. What are devices we're using? These are the basics. And or blood pressure monitor, glucometer, scale, pulse oximeter, thermometer, and a peak flow meter if they have a chronic condition that applies. But how much can you get paid? So this is public information. You can look at the codes. If you can see them, you get an amount for setup of the device. You get an amount if they log in a certain time per month. Get an amount for the first 20 minutes. There it goes, 20 minutes of time where anybody, this is staff, looking at their information, capturing certain data. This not even include like a physician, nurse practitioner. It's anybody analyzing the data. You see what you're up to at that point. And if you have an additional 20 minutes, you're adding that. So somebody's so smart, they calculate what you can get per month per patient. So I don't know if you got a calculator, which I will round down. I'll say 100. If you had a 100 patients. On RPM per month, we didn't calculate chronic care management if it pays $60 per month. Both of these patients, this patient can have both. So you calculate that, what that is per month, just 100 patients. Not to mention when you get big and have 500 patients and 1,000 patients, and we start to hire additional people to your team. So how can you do RPM without going into the home? They have vendors who would do it all for you, and that great old AI, artificial intelligence. I did not know we have vendors that have full staff. It's almost like they have a full staff of like RNs, LPNs who are calling the patient. As a matter of fact, you cannot bill if you don't have they don't have those 15 entries per month. They got staff that will make sure that it's done. They already have a staff that you don't have to pay that will do it. We're not going to double bill with CCM. It's sort of the same services, but it's a resource. For instance, with CCM, my patients started asking, well, I don't see what you're doing. And you don't do anything. You just calling me once a month. Ooh, I got y'all now, baby. We're going to put that device in the home. I got a whole nother team that's going to deal with that, and I'm going to do my chronic care management. And then that's going to help leeway you into your topics or your goals for the month. Once you look and see that RPM data, that's going to help you with your goals for the month, depending on what that data shows. Good information. So, when you're looking at vendors, some of those names are not even real. But I'm on my research. You're going to look up, you want something that's no money out of your pocket up front. A lot of these companies is zero startup. I think Home Health has a fee of maybe $3 per patient per month. I've learned type of devices. Pay attention if it's Bluetooth or what they call it cellular ready. Think about come on y'all, with Bluetooth, you have to actually go on your phone, click Bluetooth, hit connect. The patient might not be able to do that. You want a device that comes out of the box, ready to use. So that's a plus if they use like a cellular ready device versus Bluetooth. Support staff, if they got a staff that's making the phone calls, checking eligibility, you know they're going to check that. They want to make sure they get paid. They got a staff who's going to analyze the data. That's important. Do you need a contract? You want somebody that's month to month versus you want somebody month to month versus a year or two contract. Or do the devices come from them? Or you want to keep a stock with you and give out as needed? I don't want no part of it. You all contact them and give out the devices. But you may want to keep some on hand. You might meet somebody at the grocery store, sign them up, give them a device, teach them about it. What about technical support? Get you a company who you can send devices back to or who handle all of that you don't have to deal with it at all. Is there a minimum number of patients? Can you start out with 10 people? Can you start out with 50? Do they require 200 people? So that's all the things you're going to look at when you're looking at different vendor companies. So, call to action. What's this? Our boot camp is this weekend. You're getting everything that you need. 10-hour power training. Like I said, we added those other two modules, how to start a telehealth and the remote patient monitoring. Oh, and I don't leave you hanging after the boot camp. You still have access to me. You can sign up as needed to meet with me. As we said, this is recorded. You're going to leave there with contracts ready to be signed. You're going to leave there with referral forms. You're going to leave there with what? Knowing how to bill, knowing where to send your billing to. We're going to role play, annual wellness visits. You're going to have care plans in your hand or on your computer when you leave this course. So enroll now. It's only $650 for the Friday night, in and in, coming out strong, Saturday all day, 9 to 5. So if you say, hey, I'm not interested in chronic care management, we have the one-on-one. We really do a topic per week. We allow time for your credentialing to get done. We allow time for you to get a medical director. With this one, we are with you until you get paid. And a plus for this, you have access to all the boot camps. You get your one-on-one, and plus you get your 2-day boot camp when we have them. We have a payment plan for the one-on-one, one-time payment of $1,250, or you can do the 3 partial payments. And I know we have like different payment options, even with the $650 on our 100 Square. This is not a hustle. This is your business. There's nothing wrong with keeping your full-time job. Oh, these are options. We have medical directors waiting on you. They probably think I'm crazy because I got a whole team of them lined up. They're like, where your people at? They're not ready to work. I have medical directors waiting on you. So if you just want to learn about billing and coding, I can teach you that. There's nothing wrong with hiring billing and coding, but nothing like knowing how to do it on your own. We have virtual assistants who can do any and everything. It's a one-time fee to vet, get them ready for you, find them, do a background check, say who they say they are, $6 an hour rate. So nothing wrong with the backup plan. But you gotta do your part. You can't get discouraged. Got somebody I wouldn't say denied, but Medicare application got kicked out. So I'm like, okay, what was wrong? Let's fix it and do it again. Bye. Time number 3, it went through. She got approved for Medicare. Don't give up. So, physicians and nurse practitioners, you can start this tomorrow. That's exactly what I did. Now it's going to be twice I'm about to do it. I found out about chronic care management, found the patient the next day, billed for it, and got paid. I just found out about remote patient monitoring. I'm signing up within the week. I'm going to bill for it. I'm going to get paid. Well, I guess I do have to wait till May, but it's fine. It's about a month. So you all know how to reach us. All others, you can start when you get a medical director or find you a practice to partner with. All right, any questions? Let's get it. Okay. I'm not logging off yet.